All right, so we are going to go ahead and get started. Welcome to today's whyWEGO Health Patient Panel focused on health equity. So as patient leaders, it's impossible to represent our communities without really understanding and promoting health equity for all members. So today we're going to sit down with three amazing patient leaders to discuss what we can do as a community to create lasting support and, most importantly, equity and equality for all patients. So I'm going to go ahead and we're going to dive in so we can hear from our panelists. I'll introduce them, or they'll introduce themselves. But we've got Megan, Claire, Tina, and Dana. So why don't we go ahead and start with Megan, Claire. Tell us a little bit about yourself and what you advocate for.
Sure. Hello, everyone. Yes, I am Megan Claire Chase, also known as Warrior Megsy, hailing from Atlanta, Georgia. I am a 5-year stage 2A invasive lobular breast cancer survivor. I am what is called an impact influencer, speaker, and blogger in the cancer community. My blog, Life on the Cancer Train, is about the struggles of being a young adult cancer survivor while advocating for better treatments and resources. And also I discuss how racism also seeps into my cancer experience. I'm also the new partnership director at Grit Health, and a freelance writer for WebMD under their breast cancer section. And I have a talk show on YouTube with the Clinical Trial Company and Cora AI, where I interview patients, researchers, caregivers, and physicians about their experiences with clinical trials in cancer. And so as a Black woman, I continue to face racial bias and disparities in healthcare. And that's why I speak about not only the need for diversity in clinical trials and research, but also how to ignite action. So super happy to be here.
Awesome. Thank you so much, Megan Claire. We are happy to have you. That was an amazing introduction. Now let's hear from Tina.
Hi, everybody. My name is Tina Swani Om Prakash. I'm a patient leader in the digestive disease space. So by that, I mean Crohn's disease specifically, which is a form of inflammatory bowel disease. But I also have a number of functional GI disorders, gastroparesis, irritable bowel syndrome, a number of things that I talk about a lot in my work. I also live with an ostomy, an ileostomy bag. And a lot of my work centers around talking about minority health, specifically around my background as being South Asian American, and how that's played into me getting treatment for my Crohn's disease, but also opting for life-saving ostomy surgery. Many of my racial and ethnic sort of origins have led me to make difficult decisions and have, made my care very difficult. But in addition to that, I have also faced a number of disparities in my care. I'm very passionate about this subject. I have a blog called ownyourcrohns.com. I'm also known as Own Your Crohn's on Facebook, Instagram, and Twitter. And I recently launched a new platform as well called IBD Bases. It's IBDESIS. Also on Facebook, Instagram, and Twitter, mainly, involving a bunch of South Asian advocates who I'm helping to mentor around talking about their inflammatory bowel disease, as well as, potentially life-saving ostomy surgery if they've had it. So these are things that are really important to me. I want to see the rhetoric around this become normalized because this is a very stigmatized subject in my community. And I'm trying to bring forward change in a way that's meaningful and actionable in terms of eliminating health disparities and barriers to care. Thank you for having me here today.
Awesome. Thank you for joining. We're definitely interested in hearing everything you have to say. And last but not least, Dana.
I am Dana. My name is Dana Townsend. I am a patient leader in the MS, multiple sclerosis space. I have been diagnosed with MS for 17 years. And so I was diagnosed back in 2004, back when there weren't many therapies or, there really wasn't much out there in terms of education and just information about MS. So a couple years ago, well, actually it was 2018, a friend of mine and we started the Myelin and Melanin podcast. And when we were both diagnosed with MS, as I mentioned, not only were there not a lot of treatments, there just wasn't a lot of representation. And so we felt as though we wanted Black voices to be heard. The reality, and we know that now, that Black women are 47% more likely to develop MS than white women. Even though if you would look at the brochures and what you see about MS, you'd assume it's just a white woman's disease, and it's not. So the Myelin and Melanin podcast is really just sharing our experiences as Black women living with this disease and just some of the realities that we face. And so, yeah, so we're currently in season 4 and going strong. So yeah, all things MS.
Well, that's awesome, Dana. Thank you for sharing and thank you for being here. Perfect. Well, just a quick reminder before we dive in to today's event, you can use the Q&A chat, or excuse me, the chat feature for question and answers throughout the panel. We're definitely going to have a Q&A session at the end as well. So make sure that if you have questions for our panelists, just throw it in the chat and we will get it answered. So let's go ahead and get started. So our first question today, in your opinion, why is it important to advocate for minority health, and what does it mean to you as both a patient and a patient leader? And why don't we go ahead and start with Tina?
This is such a good question, Valerie. I think for me, minority health is really at the crux of my entire disease experience. From the very, very get-go, with being diagnosed with inflammatory bowel disease, I faced all sorts of disparities. Oh, Indian people don't have this. My family is from India and Pakistan. Oh, Pakistani people don't have this. This is extremely rare. But the funny thing is, it's been running in my family for at least a couple of generations. So do Indian people really not have this disease? And I was questioned from the very beginning, like, this must be irritable bowel syndrome. This must not actually be inflammatory bowel disease. Nobody actually even took me seriously, just looking at me, because of the fact that a lot of these diseases are invisible. So it was very hard to get doctors to believe me throughout my journey. Even after having 20 surgeries for Crohn's disease, a doctor at the Mayo Clinic, a fellow, asked me, "Are you really this sick? Why would I be there if I was really this sick?" So minority health is really, really important, not just for the sake of representation, but also for our stories and the diversity of our stories. So from hearing about the Black experience, the Latinx experience, the South Asian or the Far East Asian or the Middle Eastern experience, the reason why this is so important is because there are cultural nuances, racial, ethnic nuances to our disease experiences that a lot of people may not have experienced or even heard of. For me specifically, inflammatory bowel disease is not just something that's stigmatized in the US. It's extremely stigmatized in my culture, so much so that it affects your marriageability. It affects your ability to get an education or to get a job. There's automatic discrimination, what we call ableism, it completely rampant in my culture, and it's normalized. It's not something that anybody even thinks to break through. And it's one of those things where people are like, but this is just how it is. No, it's not okay. It's legitimately not okay. And that's why my platform has been created. My father suffered in silence. He died in silence from this disease, from Crohn's disease turned into colorectal cancer when he was 39 and when I was 8 years old. My aunt in India passed away at 43 from this disease. My great aunt in Karachi, Pakistan passed away in the 1930s without even being diagnosed. She bled from her bottom to death. This is not okay. This disease exists in various populations, and we are facing such significant stigmas that we can't even talk about it. Now, when it comes to life-saving ostomy surgery, that becomes even more complicated than inflammatory bowel disease. I can't tell you how many people have asked me, "Oh, so you crap in a bag?" And that's disgusting. "Oh, that must smell." This again affects your marriageability. And because it's not invisible and because it shows, people are automatically like, oh, no, 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 no. This is not something we're willing to take on. And the reason why I speak up about this, even though it brings me, and my family has said it too, Tina, how can you talk about this? This is shameful to our family. This is who I am. I'm going to own my Crohn's, like the name of my blog, because this is truly a part of my life. It's not all of me, but it is truly a part of my life. And I can't just sit back and ignore how much my culture, my religion, my racial and ethnic experience has shaped my experience with Crohn's disease and having an ostomy. I can't sit back and ignore that. I have to speak up, and I have to empower others to speak up. That's why this is so important to me.
Wow, thank you. We definitely applaud you for, speaking up about it, and just, being transparent and honest. And I don't think, we can ask for more. Dana, what about you?
A lot of what Tina was talking about totally resonate. Obviously, MS and what she's facing with Crohn's disease are different. But a lot of the things that can happen when you have a disease like MS are very embarrassing things that people don't want to talk about. Bowel and bladder and things like that. And I bring that up because I think storytelling is so important so that people know that what they may be experiencing, that happens to everybody. You don't have to be embarrassed. That just happens. And so I think it's so important to tell stories and for people to share their stories so that that people don't feel so alone. Because we know isolation with any chronic illness is a thing. So that is important. But also, I think, I mentioned before the idea of disparities and equity. I think that we all know that health equity is a structural issue. The reality is that none of us in this room on this panel can, make the problem go away tomorrow. However, I think that it is really important for people to speak out and advocate for themselves and for what they're experiencing. And so I think that that is so important. And that's a step, an actionable step in the right direction to, hey, I'm here. These are my experiences. So yeah, just piggybacking off of what Tina said. Yeah.
And Megan, how about you?
Absolutely agree with Tina and Dana. It's crucial that we continue to bring a spotlight on the health disparities because there are differences that are experienced in, different racial and ethnic populations. And we're so often left out of that conversation and the research. Like for me as a breast cancer patient, almost everyone seems to think that I have triple negative breast cancer because that's prevalent in the African-American community. Well, I don't. I had invasive lobular. And I've actually been questioned by doctors and other people within the cancer community. Are you sure that's what you have? Because, so I guess because I'm Black, I must have the one that, affects all Black people. Mm-hmm. And so what I have discovered just in my own experience is, oh my gosh, my body is intolerant of a lot of the medications. My symptoms were not, typical or the same as a white woman. So therefore, it took over 2 years for me to finally get a diagnosis because I knew something was wrong. And so I realized, wait a minute, if I can't take these medications, I cannot be the only patient who's like this. Like, what made my case different? Well, it was this, my skin, And so I'm just determined to make sure that researchers are including Black people and other people of color in their research because our bodies, they metabolize medications differently than our white counterparts. And that's something that is not talked about enough. And so as a patient leader, I really want other people of color to know that they're not alone in this fear and frustration of wanting to make their health better and a priority. We know that we just all keep hitting brick walls because unfortunately certain medications or symptoms are just not recognized because it's not studied. So it's just it's such a huge issue. And it's really just my mission as a patient leader to just keep shining that spotlight, on this major issue and the disservice to these populations that I'm a part of, and so are, our audience and Dana and Tina.
Yeah, you're absolutely right that, I mean, different races and ethnicities need to be included in the research. I mean, that's where it starts. And, I don't think you can have, this conversation without addressing that. And I think that actually brings us to the next question. I think we need to define, health equity and health equality and what that means, to you all. So why don't we start with that? In just 2 to 3 sentences, tell us, your definition of health equity and equality. And we can go ahead and start with Dana.
I'll say on a very basic fundamental level, health equity is ensuring that people have equal access to being healthy. Being healthy is a thing. It's a multifaceted thing. It's not just being free from disease, it's overall well-being. And so when we think about health, I think when a lot of people hear the word health, they think automatically medicine, disease, and things like that. But health is so huge. We talk about mental health, well-being, and that is something that is so important, especially when living with a chronic illness. Everything affects everything. It affects your illness. And so when we think about health equity, I think it's everybody having equal access to quality X, Y, and Z. So it's not just, oh, okay, you have access to this and it's, the bottom of the barrel thing. Everybody should have access to equal resources, an equal standard of resources. So I think in my mind, that's what health equity is. And again, expanding the idea of health to mental health, well-being, physical health, all of that. So everybody should have an equal chance of being healthy.
Absolutely. You mentioned, mental health and just all aspects, of health in itself. So, I mean, I have to ask the question, just knowing, that we're, towards the end of a pandemic here, how that's even played a part. That's huge. That's a whole other conversation.
Yeah. I think, and just not to hijack things, but you brought up the pandemic, and I think that, well, first of all, we're reopening now. And I think that reopening anxiety is a thing that a lot of people with chronic illness and in the disability community are facing. And it's huge. I'm not going to go too much into it because I'll take this whole conversation over and I don't want to, but it's a thing. And so mental health needs to be acknowledged times 1,000 in this time and space that we're living in right now, I think.
Absolutely. Megan Claire, what are your thoughts on, defining health equity and equality?
Well, health equity and health equality, it's like, though they sound similar, they are so different. Because to me, health equality means everyone gets the same thing. They have the same resources, all the opportunities, all the access is there. Like every person would get it. But to me, health equity means giving people what they need to reach their best health. It is customized based on, that person's race and gender and ethnicity. And so to me, that's the key to honestly, hopefully eliminating these racial health disparities that continue to plague people of color, because we cannot all be treated in the same way. I often say every body is different, and therefore we still deserve to be treated and get the access, but to make sure it fits what's going on in our bodies, in our situations.
Mm-hmm. I love that. Every body is different. That's a good one.
Yeah.
Tina, what are your thoughts?
I think Dana and Megan Claire basically described exactly what I was thinking. So I thought, let me throw in some examples so it's clear to our audience, what is health equity? But I completely agree with you, Megan Claire. Health equality and health equity are two very, very different things. I think health equity focuses more on the individual, the customizable aspects. Yes, is there equality? That's what we're looking for. But is that equality actually panning out to be equality for the person? So in terms of access. So what are some examples? So when I think of health equity, I think of people having access to potentially late night or evening hour appointments. So, a lot of us may not be able to make it to the 9 to 5 hour appointments, and we have to sort of bend our schedules, maybe call out of work or do whatever we need to go to an appointment, wait for 2 hours, and then see the doctor for 10 minutes. It's really not fair to a lot of us. What if those appointments were offered at 5 or 6 o'clock or even 4 o'clock to make it more amenable for us, more customizable for us? What about with clinical trials? If instead of me having to travel from New Jersey to New York, sitting in 2 hours of traffic wearing a diaper because I have, severe Crohn's disease and I need to get all the testing done for the clinical trial that I'm part of, instead of me sitting in the car for 2 hours with my mom driving me, what if those mobile vans could come out to underserved locations and help patients get the care that we need? That's health equity in my mind, is bringing healthcare to us in a customizable way so that we actually do have equal access.
Absolutely.
You're so right. And access is so important. So how do you guys, how does your community really navigate the topic of health equity though? Do you find the topic frequently discussed? Are people, really trying to educate themselves and having these conversations? What are you seeing? Megan Claire?
I feel like this is being talked about heavily in the Black community, but it often feels like it's falling on deaf ears to those who are the decision makers and those who truly need to understand that people of color are not getting the access to care and medications needed. And so, I feel like we just continue to keep talking about the need for health equity. I have an example of, I was in a Facebook cancer group where I shared information about a paid study for Black and Latinx women who have breast cancer. A white woman in the group couldn't understand why they were going to get paid and asked to be in the study, and she wasn't. And I shouldn't be shocked, but I was shocked and angered, because it's like, how does she not already see that she's been getting all the treatments, because the studies are continuously done, with white women in mind, and those are measured. And so it's just been really upsetting that the white privilege that sometimes is shown in the cancer community, it's really disheartening and horrifying, quite frankly, because we all deserve care and care for our bodies that fits what's going on with us. And the fact that still others within the cancer community who are non-white, who are white, are just not understanding that those who are not white, are not getting the same access to care and same attention either.
Yeah, definitely. Dana, what are your thoughts?
When I think about, how people in the MS community kind of think about, conceptualize health equity, I think, and again, I host a podcast. And so we're constantly listening to people's stories and having people share stories. And so I think that one of the big things in the MS community is the lack of cultural sensitivity that many specialists have. If you read the literature, very little literature, unfortunately, about the reality that Black people face, we see that statistically, Black people tend to be diagnosed later with MS. Okay, what does that mean? Does that mean that they've been having symptoms, but they were ignored and not believed by doctors? So all of those things make a difference. And so a lot of people share experiences that they've had. Well, first of all, we know that many times MS masquerades as an invisible illness. And so, Black people not being believed, Black people being gaslit, things like that. So when we think about that in the community, we think about, I think it's important, again, I talked about advocacy, but really sharing our stories to let the powers that be know that this is a thing, this is going on. And then, everyone mentioned clinical trials, which I think is so important. And Megan Claire, you brought up an interesting point when you brought up the situation where the white woman was feeling some kind of way because she wasn't going to get paid to be blah, blah, blah. I think that, and I'm not trying to change the whole question around, but I think that being paid is something that is important when it comes to being in a clinical trial, especially when we're dealing with people of color. One, we are needed to be in these trials, but two, being in a clinical trial, it's a scary thing, but it's also extremely time consuming. And so that is something that, and again, this is not contributing to that question, but I think that it's something that's important. But anyway, sorry. Yeah.
Yeah, no, that's definitely appreciated. I mean, that goes back, I think, to, to Tina's point about access, right? And just being able to be a part of those studies. And Tina, I mean, what are your thoughts? What are you seeing, in the community? How are they navigating this topic? And are you seeing people actively trying to educate themselves?
Again, a really good question. And I think we are doing a really good job talking about minority health, topics around intersectionality, sharing stories of, like Dana was saying via our podcast, or like I share stories on my blog of different patients who are going through different nuanced experiences based on their culture, their race, their ethnicity, their sexual orientation, their gender identity. These are all different layers that are adding challenges to experiences. But I think where I think whyWEGO Health is really moving the needle today is talking about health equity. These are buzzwords in our community that I feel like people don't really understand. Social determinants of health, health equity, health disparities. What do these terms actually mean? I mean, I'm studying for my master's in public health at Mount Sinai's public school, public health program right now. I understand intimately what these words mean, but I think as advocates, we really have to push that education out. That's why I'm so excited that we're doing this talk today, because a lot of patient advocates and patients don't actually know that they might be gaslit, that they might have accessibility issues due to race or ethnicity or what have you. A lot of us don't realize what's going on behind the scenes. And unless we have these conversations on what this actually means, what is health equity versus what is health equality, how are patients and patient advocates actually going to be able to advocate for themselves? That's why I think we need to do a lot more of this in this community, is talk about, okay, we are representing now. The last year, things are finally starting to change, and thank goodness, because I feel like we have been at this for a long time. I know I've been doing this for 3.5 years and really hoping for the needle to move, and I'm really seeing it move this last year. But what can we do further? I think we really need to talk about what are these disparities that we're facing? How can we change things? How can we have that greater representation in clinical trials? Why do we need that greater representation in clinical trials? And also, how do we help diminish things like vaccine hesitancy? And something that I'm doing that I would consider an actionable step as a patient advocate, that I encourage all patient advocates to do if they can, is working with different organizations to really understand where the disparities lie and how we can correct them. Whether that's through grants or studies of understanding what unmet needs are in different communities, even working with pharmaceutical companies or companies like whyWEGO Health to be involved in these kinds of projects. Those are key actionable steps for us to really move the needle on our care. It's not just about clinical trial recruitment. It's about us getting into the weeds and really understanding, how can pharma change education? How can patient advocacy groups change education and involve us more? And where are the gaps in education for communities like ours?
Yeah, Tina, I love that you said you're starting to see that needle move. And those are some great, actionable steps that, we can take. And, I'd love to hear, Megan Claire, if you're, seeing or, any actionable items in your community, or if you have any thoughts on that and just how patient leaders, can really help to promote health equality.
I wanted to first say, I really love what Tina was just saying, because we cannot be afraid to keep having these conversations so we can keep the needle moving forward. I think a lot of people are scared to talk about this because, talking about race, talking about lack of access, it's ugly, it's ugly, but it needs to be talked about. And we cannot be afraid to keep pushing to have this in the spotlight and keep pushing the needle forward. So I also agree as far as sharing those personal stories, because you don't know what you don't know. And when you start to see and read and hear, thinking of Dana's podcast, other stories, that will help you realize, oh my gosh, I had that same thing happen to me. Now I know how to handle that for next time, or I'm going to push back. And I often say, something actionable is know that it is your patient right to ask questions of your doctor, even change doctors if you don't feel like you're being heard. And I know in some cultures, you're taught to never question the doctor. But when it's your life literally on the line, know that your voice matters. And, we must take active roles in our treatments. And is it frustrating and unfair at times? Heck yeah. But at the end of the day, you are worth it and you matter and you deserve to get the best treatment possible, period.
Yeah, you definitely touched on something with, just not questioning doctors. I think that's just sometimes in our nature, you don't question authority. And, sometimes we kind of see doctors as, in that role of, having that authority because they're the ones that have, the expertise and the knowledge. So you kind of just take what they say and go with it. Dana, what are you seeing? What are some actionable items, in your community or thoughts that you have?
Well, just some thoughts, not to sideline the question, but both Tina and Megan Claire were mentioning, pharmaceutical companies and things that they can do to kind of help move the needle. I think that something that is really important is that pharma and other health companies need to be held accountable. Okay, it was Minority Health Month, in May or April, whatever. We're minorities 365 days a year. It's not just a month. And that performative, I can't stand that performative allyship. You come in the community, swoop in, okay, we need to, get 400 people for the study. What I think that it's so important for companies to have a vested interest in the communities that they're seeking our help for. So, I think that is something that's really important. And I bring up the performative aspect because I think sometimes in the MS community, as I mentioned, back when I was first diagnosed, there wasn't a lot of representation. It's getting better now. But I think that, something that, is discussed in the community is that we see these performative measures. Okay, George Floyd was murdered last year. Now we've got to focus on Black people and the realities that they're facing and X, Y, and Z. And so I bring that up to say that I think that, and I'll speak for all chronic illness communities, I think that performative fluff allyship is something that does nothing. We talk about these issues for a month or less or 2 months, whatever. The reality is that these are our lives every day. And we need to hold companies accountable for that. And it's difficult. And it's a lot of labor, free labor that we're giving oftentimes. And I think that that's something that needs to be addressed too. I am a big proponent of pay me if you want me to do this. That we live in a capitalist society and that's a whole other thing. But the reality is that first of all, having a chronic illness is a full-time job. Y'all all know that it is a full-time job. that being said, advocacy and all of these other things that we're doing, that's a lot of work. And so I think that that is something that we shouldn't be afraid to talk about either, being compensated patients being compensated for doing things like that. I think that's so important. We can't be afraid. And Megan Claire, you mentioned before too, I think the fact we can't be afraid to have these conversations. People get so scared and, they don't want to talk about race. It's something that we shouldn't talk about. We have to talk about it, period. Otherwise, nothing's going to happen. We can't mince words. These are facts, and we have to keep the conversation going way beyond Black History Month and Minority Health Month and blah, blah, blah. This is something that needs to be a constant thing. And so I think that's so important.
Yeah, you mentioned this needs to be something that happens year round. I mean, just given your industry knowledge and, just being a patient, what are your thoughts on how healthcare, pharma, and or payers, like how can they support the community year round? What can they do? And anyone can answer that. Dana, I don't know if you want to pick up.
Do you mind if I take that?
Yeah, go for it.
I think that's such a fantastic question. I've seen pharmaceutical companies come forward with DEAI type initiatives the last 6 months, 7 months, where they're bringing on patients to really advise on not just clinical trials, but how to be more inclusive, which I think is very, very important. But I think where things really need to start changing is with payers. I think we spend a lot of time hating on pharma for drug costs, and I understand that completely, but pharma is paying attention to patients. They are talking to patients. Payers are not, at least not in my experience. And payers are rejecting, they're getting in between doctor and patient decisions. I was just rejected for my biological agent yesterday. That's what keeps me out of surgery and keeps me alive. I'm fighting appeal after appeal since the last 2 to 3 weeks. Why does it need to be this way? And aside from minority health, like this is a major patient issue. But when it comes to minorities who are actually really, truly wanting to make sure that we get the care that we need and that we are working with our doctors to be as informed as possible, why are there so many roadblocks in us getting our treatment? When there's no other drug that's been working for me, when my phenotype of disease is so complex that this is the only drug that works for me, why is the payer getting in between that decision between my doctor and me? This is really, really challenging. I don't think payers are taking into consideration how complex disease can be for minorities and how different it can look and how many medications we may or may not respond to. And this is something that's becoming a huge problem that I don't even think we have even touched talking about. We're talking about diversity in clinical trials. When are payers going to wake up and see that, our healthcare matters too, and that our disease looks different, and that they have to take that into account when deciding when they should be paying for our medications? This is a $23,000 drug I'm on.
Oh my gosh. I totally agree with you, Tina. I literally just had this issue where they won't cover a medication because I don't technically have the illness, but I have other symptoms and we're trying to prevent it. And I'm just like, oh my gosh. I want to kind of piggyback off of what you were just saying, in that I feel like, first off, the industries, like, they already know how important this is, right? And they already know that there's a need for action. And I think about the stigma associated with Black bodies, they've just been historically been treated horrifically. And that is a stain that remains on the forefront of every Black person's mind when they hear clinical trials or certain types of medications or, certain illnesses. And I think that what many are forgetting is that these horrible experiences were not that long ago. And so in my mind, right? So in my mind, I'm thinking of the trust must be built first. Like, what do you need from us? Have that dialogue with community leaders and outreach to those communities. Like, how often do we have an honest conversation? And we need to take that to the next level. the industry leaders need to understand the historical pain. Instead of talking at us, talk with us, and let's start closing this gap together.
Absolutely.
Absolutely. Dana, what do you think?
You know, I think that something that's undergirding all of this is that we're whole people. You know, that's one of the things in the podcast this season. One of the things that we're focusing on is the fact that whatever disease we have, you know, you're not just a set of symptoms. You are an entire person. And when we talk about health equity, all of these other things, it's not just about getting a medication that I need. What about the side effects of that medication? Do I have somebody who's going to help take care of me? Do I have the community resources and supports? That is something that's so important. And I think that that is something that gets left out of the conversation when we're talking about health equity. All of the other things. I mean, that's huge. And again, that relates to mental health as well. I'll just talk about MS specifically. People with MS I think they're double, there's a double incidence of, I'm getting these words all wrong because MS, but they're twice as more likely to commit suicide versus the general population. So that's a whole other conversation. However, I can say as somebody who has MS, you know, it's not just, okay, I got my medication and things are going well. No, I have all of these other things that I have to deal with. Do I have transportation? Do I have somebody who's going to help me do the daily things of life so that cook, clean, you know, things that help you lead a, you know, well-balanced life? These are things that aren't always talked about, and they need to be talked about. And so when we talk about these disparities and access to resources and things like that, these are conversations that we need to have too, because we're not just sick people, we're whole people.
Yes.
And so that's so important. We can't lose sight of that.
Yeah.
So, yeah.
You ladies are absolutely right. I mean, are there any resources or organizations, you know, or even your fellow patient leaders that our audience should be following to just, you know, continue educating themselves on this topic?
I'll say in the MS community in particular, Dr. Mitzi Joy Williams, she is an MS specialist, a Black neurologist. She's amazing and wonderful, and she does a lot of brilliant research on the realities that Black people face. Black people who have MS face. So I think that she is really important, a really important person to know her work in the MS space. But I think too, and I'll let Tina, Megan, Claire speak as well, but I think that it's important to seek out content creators and people who have your disease, and seek out people of color in your communities, the content creators. That's a lot of times where you're gonna hear the real there. You know, it's not sugar coated, because a lot of times organizations want to paint pretty pictures. Okay, this is how this is. And we know that our experiences many times are counter to that. So I think that it's important to get out there and listen to what the real folks have to say.
Yeah, I love that. Megan, Claire?
Oh my gosh, yes. I love that so much because in my blog, I don't sugarcoat anything. I'm very raw. And I think that's why it resonates with so many, you know, and, but I also love the information and resources that I've seen on sites like Diverse Health Hub and Black Health Matters. I've been able to get a lot of information or think of some other resources that I hadn't thought of before. So I thought that was a pretty good one. And then like, I'm still looking for some sort of, you know, clinical trial. And when I look at clinicaltrials.gov, I'm like, I don't know what the heck I'm looking at. Even people, you know, that have like 10 million PhDs don't even know how to read it. So I look at the clinical trial website and Cora.ai because they have vetted trials that are available and the criteria that they're looking for. And it's just much easier to look at. But I also agree with the like content creators. Like a lot of times you might think, maybe I'm being too sensitive. Like you kind of question yourself sometimes when these situations happen and you're being talked down to by the people that are supposed to be keeping you healthy, and how you're being denied for tests, and knowing that you can push back. Like standard of care, I'm really jazzed about what they're doing. You can find them on Instagram. We've been having really great conversations about health equity and our standard of care. And so it is starting to be talked about, especially those of us who have not only had cancer, but then have like the chronic illnesses and those side effects that continue on, because at the end of the day, our quality of life matters. Like, I don't just want to be existing. I want to actually
100%. Mm-hmm.
Absolutely. Absolutely. On my end, I would say that there's a number of organizations that I've worked with, from the United Ostomy Associations of America to Crohn's and Colitis Foundation, ARDA, which is an autoimmune society. I think they're really trying to ramp up in terms of minority health and hearing our stories and making a difference, and also pushing for studies in this space. I know the Crohn's and Colitis Foundation is doing a great job with that. There's also a new organization called the Association of Black Gastroenterologists and Hepatologists, ABGH, I believe it's called. And so there's a bunch of Black GIs that are a part of that, really doing some excellent work in terms of moving the needle on colorectal cancer, and also for inflammatory bowel disease and liver disease in the Black community. I know on my end, I'm trying to bring a consortium of South Asian doctors as well as South Asian patients together via this IBD Bases platform to make sure that we start doing more studies, not just, for the South Asian diaspora in the US, but really the South Asian diaspora around the world, but also South Asia itself, which is seeing exploding numbers of inflammatory bowel disease the last 10, 15 years. So really, I think as patient advocates, we have to keep pushing doctors and organizations and being involved in this space to make these things happen. I think that's part of our role, to move the needle on these things. I've seen a lot of good work come out of the American Public Health Association as well in terms of minority health and trying to make sure we eliminate health disparities in care. And that includes COVID vaccine related disparities. So I think there's a lot that can be done, but there's a lot of organizations that are forming and that are really moving towards working towards this and changing things for our future.
Yeah, definitely. Thank you for sharing these resources. And, for our listeners, we've definitely been capturing this in the chat. So hopefully, everyone can take note of that and take advantage of these, great resources. Earlier in the discussion, we talked about skin color playing, a factor in finding a doctor. So do you ladies have any tips for, being able to find a doctor that does look past skin color?
That's a loaded question.
It is. So loaded. If I were to tell you, Valerie, how many doctors I've been through in the last 15 years, it's not second or third opinions. It's, to get somebody to listen to us as women and women of color is really hard.
And it's tiresome. And sometimes I actually have to take a break to be like, you know what? I'm just going to live in this pain for another minute, because I mentally just cannot keep trying to get the help I need. And so what I have done is I go in, I have every symptom, everything I'm feeling, I have that sucker printed out, because I know that sometimes when I get into that exam room, all of a sudden I'm like, oh my God, what's happening? What am I saying? And you're also very vulnerable sitting on that exam room table. So I have it printed out. And then I'm looking at their facial expression. And if they start to question me, I will say something to the front desk and say, you know what? I do not feel comfortable with that doctor. I want to find someone else. And I don't want that particular doctor to contact me, because Dana has been talking about too, you got to protect your mental health too. So if they're saying something to you and you're not feeling well, trust your gut and that this isn't sitting right with you.
Yeah. And I know sometimes it's really hard for us, I think, to see progress in all of this, that we've talked about. And I guess the question is, how are we going to measure success though? When we do see the needle start to move a little bit, as we talked about, how do we measure that?
That's hard. I think that, going back to the idea of listening to people's stories, when we start hearing that people's experiences are changing, I think that's something that's huge. A lot of this, I don't think can be measured. You know what I mean? A lot of this is subjective. They're very experiential things that we're talking about, like being kind of gaslit or treated weird, or, we can measure things like, how many people have had access to, how many people have been vaccinated, whatever, things like that. But I think that it's gonna take really a shift in the culture. To be honest, it's beyond, just the, quantitative things. It's a shift in the way that we are doing things. The doctors are seeing people, you know what I mean? So that's a really tough question. I don't even know if it can be measured, me personally, to be honest.
Yeah, and a question from our chat. I mean, a shift in culture, how do we do that though? Do I need to get into legislative advocacy to be able to make an impact, in this area?
That's such an interesting question. And I'm speaking, aside from my career as an MS patient, I also am a sociology instructor. And so I think about all these things on macro levels, and I think that it's so important. So at the end of every semester, I have students tell me, I've learned all this information. Now, what am I supposed to do with it? There's so much that's messed up with this world. What do I do about it? And I think that it's important for people to stay in their lanes. So if getting involved in, legislative action, calling your lawmakers and things like that is something that you feel comfortable doing it, do it. You stay in our lanes. If, starting a podcast, for example, if that's something that is in your lane, do that. Get the word out and speak about it however you feel comfortable. Because the reality is that, okay, everybody call your senators, this bill needs to be passed. Like, those are very short-term things that people aren't going to stick with. You have to kind of find your niche and what you're comfortable doing and just try to be committed to, doing things in that lane, if that makes sense. Because I'm not going to tell everybody, everyone's got to go to Washington and, you know what I mean? That's just not a reality. We've got to do what's comfortable. People have to do what's comfortable for them.
Well, I think also, Valerie, I think also too, it's very easy to feel overwhelmed because you're there's so much that needs to be changed. There's so much that needs to be done. So it's really finding what touches you the most, what has affected you the most, or your family or your friends the most. And that's when you become passionate, and that's when you find the lane that you want to be in. And that doesn't mean that you can't evolve over time and go into something else, but it's finding what that is for you and your mission. Because when you're speaking from the heart and you're using your voice and your experience, that's what resonates with people. That's what will make someone stop and be like, I never thought about it that way, and that's what you want to happen, is people to think about things in a different way. And that's how I think we start to push that needle forward.
Like you said earlier, Megan Claire, people don't know what they don't know. And that's a reality. So, yeah.
Definitely. Tina, did you have any thoughts on that, on just someone who might feel they need to get into legislative advocacy?
Legislative advocacy, is something that I've been involved in the last few years. And I think it is an important thing to get involved in if you'd like to. I think that there's a lot that we can be doing on social media and via our blogs and podcasts and what have you, aside from legislative advocacy, that can really push the needle. But my experiences with legislative advocacy have been very positive. To be able to go in, speak to congressmen and women and senators and their staff, it's a different feeling of not just exhilaration, but, oh my God, I'm really changing things. And how I've been involved in that is really sharing my experiences around step therapy and medical nutrition, specifically in the Crohn's disease space. And I won't get into details on that because it's going to take a while. But there's been a lot of issues with insurance covering medications, as I was talking about earlier, and requiring us to fail other medications first and not getting access to medical nutrition. And as you can imagine, with a digestive disease, you lose nutrition easily. So fighting for these things, lobbying really hard for these things and to get coverage is extremely important. And to have minorities doing that is very, very important, because a lot of us don't feel like we can get the care that we need. A lot of us feel like, we're already having access issues, or that we're already being discriminated against or gaslit in many ways. And so legislative advocacy is just another way for us to push that needle forward. Like Megan Claire was saying, like it's very, very important, if we are able to do that, to do so, because I think there's nuances to our minority experience that we can bring up to legislative to legislative panels and share with them, look, this is a little bit different for me, and this is why, and this is how it affects me differently, and this is why I absolutely need this. I've been doing a lot of work with this, not just going to DC, but virtually, and also, via articles, and talking about it via articles, that this is not covered for me. And these are sort of the barriers that I've faced. So legislative advocacy can take many forms in that regard as well. We can send letters, we can call our senators, we can call our congressmen and women locally as well, to get involved. It's not something that, we have to go down to DC to do. So that it can take many forms. And I do encourage patient advocates to get involved if they are able to, health permitting and whatnot. But I just want to say, in summary of all of this, I just want to say a reason why I got into all of this is because healthcare ultimately is a human right. It's become this capitalistic venture that takes away from us as minorities. And we are having to fight tooth and nail for it. And it shouldn't be that way. It should be our right.
Yeah, you're absolutely right. I know that we are approaching time, so I just have one last question, and anyone can answer. What is one advocacy project or event that you have coming up this year that you're excited about? Just one.
I will say for me, writing is my big thing. And so the more I can get into different publications, like writing for WebMD, like that's a really big deal for me. And I think it's important that they see a face that looks like mine. So I think for me, it's about getting it on websites and organizations where they don't typically have a face like mine, who is sharing a story, so I can help get a seat at that table and make the way for others.
Awesome. Thank you. Well, 60 minutes, is definitely not enough time for us to really dig into this conversation and, tackle every facet of health equality and health equity. But, this is definitely a conversation that we have to have all year round, and it's got to continue. And, here at whyWEGO Health, we're continuously learning alongside our patient leaders and, just how best to navigate these conversations and what we can do to really promote. So, I definitely want to take a moment to recognize those who attended today's call. And, as patient leaders, you all play such a vital role in advocating, for health equity and equality. So cheers to you for taking those steps to do that and to really, navigate and lead us in this discussion. And of course, to our powerhouse of panelists, each of you, you all have added such great insight and important considerations, to this conversation. So we thank you for being here today and taking that time to educate our communities and just really fighting to represent all members of your network. So we will reach out with a recording next week for anyone who would like one and, to share this discussion with their communities. But again, thank you all for being here and have a great afternoon.